Hi everyone and welcome to Persian Money channel. My name is Arash Shahriari. I'm a licensed health and life insurance agent as well as an IRS enrolled agent. And in this video I want to go over some of the key definitions that people and terminologies that you may run into when you're wanting to sign up for a health insurance plan. The three main ones is a deductible, co-insurance, and out-of-pocket maximum. So I want to spend the first part of this video talking about these three, and spend the second part talking about the type of the plans that are out there, and you might have heard them as either HMO, EPO, or PPO. So without going into the jargons and the legal definitions, I want to just lay out the answers for you. Now for the first part, I often use an example, and the example would be an individual who goes to a hospital and comes out with a hospital bill of $11,000. So let's say this individual has a health plan that has a $1,000 deductible. That means that before insurance kicks in and pay any portion of this bill that you have received, that person has to pay the without any questions or haggling, the first $1,000 of that bill. So once that is satisfied, the deductible, then you move on to the phase which is called co-insurance phase, where the insurance company and you start sharing the cost of the medical bill in between yourself. So let's say if you have a silver tier plan, for example, that means that on a 70-30 basis, 70% insurance company and 30% yourself, you start paying for that bill, the $10,000 bill, that is the remainder $10,000. That is, so you will be paying another $3,000 on top of the $1,000 that you've already paid. What defines here the out-of-pocket maximum is, let's say the plan that you're having has a $2,000 out-of-pocket maximum. That means that even though your share of that medical bill was $3,000 and you already paid $1,000, your cost would be capped at $2,000. So once you satisfy that out-of-pocket maximum cap of $2,000, even though you're still responsible for remainder, that would be the cap, and even the remainder would be covered by the insurance company, and you don't have to pay anything else. The deductible and out-of-pocket maximum for most health insurance plans, with the exception of the original Medicare, deductible and out-of-pocket maximum are annual. The cost that you pay for the co-payments, for example, for your visit to the doctor, what you pay for your drug medication that you get from the pharmacy, for example, or depending on the plan that you have, maybe other costs that are also count as satisfying the deductible. You only pay one time in that example, for example, that $1,000. And the same manner for the out-of-pocket maximum. So from the January 1st till December 31st in a one annual basis, calendar year, this is just a one-time thing. Once the year renews, your deductible starts afresh, and so does your out-of-pocket maximum. Now the second part that you may wonder has to do with the name of these plans that you run into. So HMO basically it refers to a type of a plan that is managed on a limited network of doctors and providers, that is. So you cannot just go to any random doctor that you fit and you wish to. No, you have to only see doctors within the network of the providers that participate with the insurance company that you're with. Now obviously you can go see somebody else, but insurance is not going to pay for it. If you want to get coverage, that is the limitation that is put on you. The other thing about with HMO plans is that before seeing any specialist, you have to get a referral from your primary care physician. So there is another limiting issue that might pose as a limitation for some individuals. Now, the other term that you might run into is PPO, basically. So PPO is a type of plan that enables you to see anybody. You can, as you wish, go to any provider and see them. However, the issue with coverage of the insurance that you have is that usually there's a different schedule of coverage for the out-of-network providers versus the in-network. So that network that we called in, we talked about the HMO, basically the same network still is in place, and yet you can see doctors outside that network, and the insurance company will pay for them. However, it would not give you the same coverage. For example, if you see a doctor, a specialist within network of the insurance company, and you pay $20 for your visit, if you're going out of network to see any doctor, that would be, for example, $40, $50. So you still get something, but typically it's not the same rate as in network. The other good thing about PPOs is that you don't need to have a referral from your primary care. You can directly just, as you wish, go see a specialist. So it's a trade-off that basically you could take advantage of. That's what you find in your advantage. Now, EPO basically is a in a way, I'm not going to even use the word a hybrid. It's basically the same HMO plan. The only thing is that you don't have to get a referral from your primary care to see a specialist. That is the only difference between HMO and EPO. So with that being said, I hope this video was helpful for you. If you have any questions about your insurance needs or taxes, be happy to assist you. My contact info is in the description. Till the next time, have a great day.